Everyone, thank you for joining us for this series of Grand Round speakers. It's such an honor to have Dr. Susan Handy with us, and it's a pleasure to be introducing her. Dr. Handy is such a big figure nationally and internationally on working on sustainable transportation and research that really is transforming the way we are thinking about transportation and mobility from point A to point B, how to integrate sustainable ideas into that. Her work has been widely adopted and integrated into changing in policy and practices at different levels, at the state and national, state and local level by California Department of Transportation and many more agencies, and at the national and international level. Dr. Handy is a distinguished professor in the Department of Environmental Science and Policy and director of the National Center for Sustainable Transportation at the University of California, Davis, which is a federally funded center. I think is the only national center, university transportation center that focuses on sustainability and transportation. She's internationally known for her research on the relationship between transportation and land use, particularly the impact of neighborhood design on travel behavior. Her current work focuses on strategies for reducing automobile dependence, including bicycling as a mode of transportation. She's the author of Shifting Gears, that's published by MIT and MIT Press, and many more books and articles that intersects transportation with sustainability. Dr. Handy, back to you.
Thanks. Thank you so much for the invitation to be here, and thank you all for being here virtually. I'm sorry I'm not there in person to talk with you all, but I appreciate the opportunity to practice what I preach and save on the greenhouse gas emissions associated with flying across the country. So let me see if I get my screen sharing right here. How does that look?
Good.
You're not seeing my notes?
No.
Right, okay. So what I want to talk about today is the ideas that shape transportation and what they mean for health. And spoiler alert, they mean a lot. So transportation in its current forms harms human health in countless different ways we can talk a little bit about. And as recognized by the WHO. But what's good news is that efforts to promote sustainable transportation, the kind of work that my center is doing, will also contribute to healthier transportation. So the problem in the US is that we really haven't paid, I would argue, sufficient attention to this connection between transportation and health. Because what we've focused on in the transportation profession is the prioritization of cars. And we've been doing this for over a century now to the detriment of other healthier and more sustainable modes of transportation. So that has created, as I said, countless health concerns, safety being a very obvious one, not only safety of people in vehicles, but also safety of people outside of vehicles. Pollution, air pollution most notably, and we've made progress there, but also water pollution, noise pollution, and other concerns. Transportation has implications for physical activity. So, the fact that so many US adults are failing to meet the CDC recommendations for daily physical activity is in part due to the fact that they are driving rather than walking, biking, or taking transit to get where they need to go. And then we can also think about access to, for example, healthy food, access to medical services. Transportation plays a huge role there as well. So what I have been thinking about as a part of the book I recently published, and it's my only book, so I'm very proud of that. I finally got one done. Is why it is that we are so stuck on this focus on driving. And my theory that I explore in the book is that it's because of this set of ideas that are deeply embedded in the transportation profession. And these ideas make up a way of thinking that focuses on making it easier to drive, which has not been particularly good for health. And when I say embedded in the transportation profession, what I mean, for example, is that they're embedded in some of the key guidance documents that really dictate how the profession does its work. And these are very sort of technical, nerdy documents, but they're really influential in the field, and in particular in dictating what we do with the roadway system. So those traditional ideas embedded in these documents explain a lot of why we're doing what we're doing. But there is a glimmer of hope in that if you look at the latest versions of these documents, we are starting to see some signs of change, a change in thinking, and a little more attention, not just to cars, but also to other modes of travel, including walking and biking. So that gives me some hope. And in fact, if you look at the discussions and debates in the field, you can find for each one of those very traditional ideas an alternative idea that's not entirely new. Some of these alternative ideas go back almost as long as the traditional ideas. But they just have never had the same sort of credence or dominance in the profession as the traditional ideas. But there are some signs that their influence is growing, and that to me is a good thing, because these ideas add up to a way of thinking that aims to make it easier and safer to not drive. And again, that could be a very good thing from the standpoint of health. So I'm going to say a few words about each of these pairs of ideas without trying to get too wonky about it, and then finish up with some overall thoughts about where the field is headed and what that might mean for public health. So I think a lot of our problem really goes back to this idea that cars equate to freedom. Freedom is of course, a very American idea. The car as freedom is also a very American idea. You know, we talk about the freedom of the open road, which is a cliche, but also kind of the truth. And it's certainly true that cars can give us the ability to go where and when we want to go. So there is a lot of freedom associated with cars. Sometimes I think about, the issue of evacuation in the face of wildfires like we have in California, or other sorts of natural disasters that happen elsewhere in the country. And the car can be the difference between life and death, quite literally. But of course, cars don't always mean freedom. Cars are a huge financial burden on our households. Not everyone has access to a car. There's nearly 10% of US households that do not own a car. A surprisingly high share of low-income households. So nearly a little over 25% of households with incomes less than $25,000 a year actually don't own a car. But to me, the startling thing is to turn that around and think that 75% of households with low incomes do own a car at very significant financial burden. So why are they doing that? They're doing that because really they have no other choice to make their daily lives work. So owning a car is not all about freedom. It's also about significant burden. And of course, not everybody has access to a car for one reason or another. So we rely on transit to meet the needs of these car-less households. But transit is not a particularly good substitute. It's often not fast or convenient. And that's a burden on people's lives. And some riders, women in particular, face very real concerns over their personal security when using transit. So all of this suggests to me we need a broader conception of freedom when we're talking about transportation. And that's where this idea of mobility justice, as articulated by this group called the Untokening Collective, as well as others, is really important, I think, in that it puts transportation into a larger context and brings attention to the connections between what we're doing in transportation and all kinds of other policies that can constrain people's movement and ability to get what they need, especially when we're talking about members of marginalized communities. So this idea, I see some hope in the fact that we are thinking in a more mobility justice way in the transportation profession, and that to me is good progress. So the second idea is speed, and closely related to the idea of freedom. We like going fast. Speed is thrilling. There's psychology about all of this. From a transportation profession standpoint, we define speed as efficiency. An efficient transportation system is one that gets people where they need to go quickly. So a lot of our work is about trying to minimize travel times. So speed as a goal. But of course, we know what speed means from a safety standpoint. It's not only more dangerous for people in vehicles, but it's especially dangerous for people outside of vehicles. So you've probably seen graphics like this that demonstrate just how much more dangerous it is when cars are going 40 miles per hour rather than 20 miles per hour. So speed may be, a reasonable goal, but it certainly comes at the expense of safety. So what do? We set speed limits, and we set speed limits using this kind of crazy thing called the 85th percentile rule, which I'm not going to try and explain. But the point of this rule is that we are setting speed limits based on how fast drivers are actually going, rather than thinking about how fast do we want drivers to go and setting our speed limits accordingly. So there's been some movement away from this approach to setting speed limits. Lots of communities have adopted these 20 is plenty campaigns to try and reduce speeds in residential areas. But of course, part of the problem is that it's hard to get people to drive more slowly if our roads have been built for speed. And that's what we've been doing in the transportation profession. In the name of safety, we have been building straighter roads with wider lanes and with what we call clear zones at the side of the road where we don't want to have trees or other obstacles that drivers could crash into. So our design standards which focus on making the road as fast as possible while also attaining a desired degree of safety, have led to roads that may lower the risk of crashing, but they also lead to higher speeds, meaning that when crashes do occur, they are more dangerous. So it's pretty clear that when we think about this concept of design speed, the profession has erred on the side of prioritizing speed over safety. So we've built these roads that make it easy for people to go fast and natural for people to go fast. They don't even think about, the fact that they're speeding because it just feels like the natural thing to do on that road. So a lot of communities have adopted traffic calming strategies as a way to address this problem. And really what this is about is fixing the design mistakes that were originally made. So speed bumps, traffic circles, various other kind of devices are making up for those design mistakes and trying to create roads that will naturally get people to drive more slowly. And, if we really want to take it a step farther, we might start to think that slow can actually be a good thing. Look at the slow food movement. Maybe we have a lesson to take from that. So some communities have now implemented these slow street programs, recognizing all the benefits that can be accrued if we slow down traffic on these streets. That picture on my right, you may be wondering why that's in there. Those are two of my former students who happened to bump into each other on the train between Sacramento and San Francisco. And of course, they had to take a selfie and send it to me. But my point here is that, this is the, transit isn't always slower than driving, but sometimes it is slower than driving. But for that slower speed, you get some other benefits, like you can sit and relax on the train and work, and maybe you'll bump into an old friend along the way, something that wouldn't happen if you were driving. All right, so the idea of speed is closely tied to the idea of mobility, which is a very widely used term in transportation. Mobility can be defined as the ease of movement. So if we focus on mobility and transportation, we're focusing on the goal of movement, the goal of making it easier to move. And of course, as I'll talk about in a minute, we're talking about vehicle movement for the most part. The corollary to mobility is that congestion is bad because congestion restricts our ease of movement. So of course, congestion is bad. I don't think any of us would say we like congestion. There is lots of research out there about the costs of congestion, including commuter stress, which has very real health implications, physical health as well as mental health. There's lots of research about the economic impacts of congestion. So of course, it's not something we necessarily want to have. It is a central focus in how we plan our transportation system. We use this measure called level of service. It's a measure of the performance of the system. It's a function of the volume of traffic relative to the capacity of the system. And it is ultimately a measure of congestion. It is, I would argue, one of the most consequential measures in transportation, in that it is behind so many of the decisions we make about our roadway system, and in particular, the capacity of our roadway system. So a very deeply embedded idea in the profession. But as others have argued, maybe that isn't really the goal. Really, maybe what we should be focusing on is the goal of accessibility. So instead of ease of movement as the goal, we can think of movement as the means to the end ends being getting what we need and getting to where we need to be. And that's where the idea of accessibility is very important. And again, this is not a new idea. People have talked about this for decades. There's a lot of talk about it in the transportation profession now, but not necessarily a lot of action based on this idea that accessibility is really the goal. I like the idea of the 15-minute city as a way to explain this concept of accessibility. Maybe you've heard about this idea, popularized in Paris, but it has deeper roots than that. But it's the idea that we should be planning our communities so that we have most of what we need within a 15-minute walk or bike ride or, relatively short distance. And the point is that if we put the things that people need within closer proximity to where they live, then speed doesn't matter so much and mobility doesn't matter so much. We've got things close by. So this has become a very popular idea around the world, and lots of communities have adopted this. It has led to its own backlash, which is a whole nother story that I won't get into here. But again, this is an alternative way to think about what it is we're trying to achieve with our transportation system than this focus on mobility and ease of movement. And I think you can see how this sort of an approach would lead to a much healthier kind of community than when we're focused on moving cars. And of course, that is what we've been focusing on, is mobility and ease of movement for vehicles. The idea here is that it's the job of the transportation professional to accommodate vehicles, to maximize vehicle throughput. We measure vehicle throughput, we design spaces for vehicles. And I don't have to tell you some of the problems we are having with vehicles. One very significant problem right now is that vehicles are getting bigger, and not only are Americans and people around the world buying more SUVs and trucks, pickup trucks and the like, but all models of vehicles are getting bigger. So even the small cars have been getting bigger. Bigger vehicles do more damage, and they create more blind spots, so they increase the likelihood of incidents happening. So they're a big problem, and there's been chatter about maybe we need to do something about this, but not much action yet. And then, of course, another problem with vehicles and bigger vehicles is simply how much space they consume. Cars consume far more space per person than other modes of transportation. You may have seen a version of this meme on the right, where you take the same number of people, put them in cars versus a bus versus on bikes, and you're talking about a very different consumption of space. And that's really important for our communities, because there is an opportunity cost to devoting so much of our land, and especially our public land, for cars rather than people and other uses that are important to our communities, like parks, for example. So I'm happy to say that there has been some movement to think about other ways we could use our public, what we call the right-of-way, the space that we have available for the street, that maybe it shouldn't all be devoted to cars, but we can think about ways of reallocating that space to make sure we're taking care of other users of that space and other modes of transportation. So road diets have become popular around the US, where you take some of that space from cars and turn it over to create a nicer pedestrian environment, to create a safer bicycling space, to better accommodate transit in the system. And again, I think it's probably pretty obvious how this could be a very good thing from a health standpoint. Perhaps where we've made the most progress towards thinking in a new way is with respect to parking. Parking is one of these, well, kind of behind the scenes, but very important policies in our communities that can have a huge impact. Most cities have what we call minimum parking requirements that dictate for particular businesses how much parking they're going to have to provide. And the problem with these minimum parking requirements is that they've led to an oversupply of parking. Even this time of year when people are out Christmas shopping, you still see lots of empty spaces in our parking lots. We have clearly oversupplied parking. So a lot of communities are doing away with their minimum parking requirements. Minimum parking requirements are now prohibited in California in areas that are in close proximity to high quality transit, like light rail systems or other forms of rail, which is a great thing. And when you think about it, a place like California, where we have such a housing shortage and a housing affordability problem, wouldn't it be nice if we could be using some of that space that we've used to house cars to instead house people? So this has been a really positive change. And again, I think at least indirectly has some important health implications as we reduce that land devoted to parking and think about other ways we can use that space to the benefit of people. So all of these ideas lead to focus on capacity. So to ensure ease of movement for vehicles, transportation professionals focus on providing enough highway capacity to accommodate all of the demand that there is. And this has been really a main focus of the profession since its beginning, providing capacity, enough capacity to meet needs and to ensure that that we do not exceed unacceptable levels of congestion. So we use these fancy travel demand forecasting models to predict where congestion is going to be. And then based on that, we decide where we need to add capacity. And this approach really goes back many, many decades. But what that approach ignores is this phenomenon we call induced travel, which is what happens when we widen a highway. So you widen the highway, the immediate effect is that traffic speeds up, travel times go down, and that is in effect a reduction in the cost of driving. And what happens when you reduce the cost of something that people want? People consume more of it. So when we add capacity to the system, we increase the amount of driving that people do. And there's a very robust body of research out there now that documents this phenomenon. My team's we've not done that work ourselves, but we've been kind of at the forefront of reviewing all of that evidence and synthesizing it and trying to help policymakers understand this phenomenon and its significance to the decisions that they're making. Despite all this good evidence on this phenomenon of induced travel, highway widening projects are still promoted by agencies as a way to reduce congestion. And what the induced travel phenomenon means is that when you widen a highway, you're accommodating more driving, but you're not really reducing congestion. So anyway, I can talk forever about this because this is really consuming my life at the moment. But the problem is we're just very stuck on this idea that we need to keep adding that capacity, even in the face of evidence that it's not helping to solve the problem that everybody is saying it's going to help us solve. So there's been some movement away from this focus on widening freeways. There was a freeway project in Los Angeles that got dropped a couple of years ago, where the California Department of Transportation, Caltrans, finally decided, yeah, you're right, this project really just doesn't make sense. And that was partly because of the air quality impacts, but also recognizing that it wouldn't necessarily reduce congestion. There's been some rethinking in Colorado about all their highway widenings. Minnesota's making some moves in that direction. So I don't think we're anywhere near the end of freeway building, but at least there's some signs that we are rethinking whether it makes sense to continue with our traditional approach of expanding and widening endlessly the freeway system. And the alternative, if we think that adding capacity isn't really helping, then what we need to be doing is thinking about managing demand instead. So this is where strategies like the congestion pricing, which looks like it's finally going to happen in Manhattan, is really important. That this is really the only effective approach to addressing congestion, is to think about managing demand and doing that with various forms of pricing. I'm quite excited to see what happens when this goes into effect in Manhattan. And my prediction is that it creates a much nicer environment for people in the city, in terms of less traffic, less noise, less emissions, much nicer environment for people walking, biking, and simply hanging out in the city. So my next three sets of ideas I won't go into in depth, but these three pairs of ideas are really about what kind of capacity we provide, how we design our transportation system, how we operate our transportation system, our roadway system in particular. And in this case, it's not so much that one idea has dominated the field with an alternative idea out there that some people are trying to push. But in this case, the profession has sort of flip-flopped between these and is aiming for some sort of balance between them. And the question is, what sort of balance? But in doing so, as always, the priority has been on what's going to be best for cars and the efficiency of the movement of cars. We could instead think about these ideas with respect to other modes of travel. So, for example, thinking about priority for transit and creating more separate spaces for transit, or prioritizing transit in terms of how we our traffic control for these roadway systems. Let's give priority to transit rather than cars. And similarly, we could be thinking about these ideas more from the perspective of the active modes. And again, the efficiency of their movement, but also especially their safety and their protection from cars. So we are seeing some more attention to this in most of the big cities, I would say, more thinking about how do we prioritize transit? How do we make the active mode safer through how we design our roadway system, and thinking about separation and control and all of those ideas. And then last but not least, I want to say a little bit about technology, because this has been a really important idea in transportation. I think, again, this is a very American idea. We like to think that technology is going to solve all of our problems. And the nice thing to think about with technology is that maybe it can solve our problems without requiring us to change our behavior in ways we'd rather not change our behavior. So it's kind of a we can have our cake and eat it too approach. So technology has, of course, been really important in transportation and for addressing some of the problems that we have in transportation. So technological advancements have helped us reduce the emissions of pollutants from our vehicles. Technology has helped vastly improve the safety of cars, though not as much as we need or would like. But yeah, so technology has been important. It's been a very positive thing in transportation. But we tend to overbelieve in it. How many different kinds of technologies have people put forth as being, the be all and end all solution in transportation to give us the kind of efficiency we want from a speed standpoint, while also ensuring safety and reducing environmental impacts and all of that. So technology has also been a big disappointment. And I like to think about, of course, the fact that our future mobility is not just about new technologies, but it's also about new versions of old technologies. So modes like transit, biking, walking, even scooters have always worked pretty darn well. We just haven't invested much in them or given them the sort of attention and priority they arguably deserve. So they work pretty well, but they could work even better if we really prioritize them and invest in them. And again, we're seeing signs of this happening, especially in cities. So important innovations like bike share systems, which have made biking more possible for more people and has gotten more people on bikes and is an important part of the transportation system in urban areas. Electric assist bicycles, e-bikes, also known as pedelecs. Anybody out there have an e-bike? I love my e-bike. They're great. The sales took off during COVID. We're seeing lots of e-bike use all over the place. Again, getting more people on bikes and making biking more possible for more trips because you're simply going faster, and there's evidence that people feel a little more comfortable on e-bikes as well. And then, of course, that's being these two new innovations being put together with e-bike sharing. A lot of the bike share systems now are e-bikes. And again, that's just making the mode that much more viable in our cities. And again, health implications, good evidence that even when you're riding an e-bike, you're getting a good amount of physical activity. And it's also, if it's getting people out of cars, which our own research shows that's part of what's happening, it's helping to create a nicer street environment for other active travelers as well. E-cargo bikes, this is one of my favorite things. Whether it's, families using these buckfeets to haul their kids around, but also delivery services that are thinking about how can we use e-bikes to do deliveries. And if it's replacing a big truck, again, that's helping to make a better street environment for everybody. We could talk about e-scooters. I know they're controversial in public health circles. I guess there's a little bit of physical activity associated with them, and some physical benefits, but also obviously a lot of concern over safety and the injuries that occur with scooters. So I'm a little ambivalent about them, and maybe you are too. But from a health standpoint, but from a transportation standpoint, again, they've been an important addition to the system, filling what we call the first mile, last mile need in transportation, getting people to and from transit. and also just simply providing people with another alternative in the transportation system. Okay, then what about vehicles? I should say a little bit about this. So electric vehicles, yes, a hugely important part of the sustainable transportation effort. California now has a very ambitious target, well, actually requirement that all vehicles sold in California by 2035 will be electric vehicles. Doesn't mean all the vehicles on the road will be electric. That'll take some time, but every new car sold is supposed to be electric. Huge environmental benefits that also create health benefits. Yeah, so a positive thing. You know, there are some downsides, however, because these vehicles are heavier. So that leads to safety concerns, especially for bicyclists and pedestrians. There's also a tire issue. The tires wear down faster, which is an environmental issue and a health issue. The batteries, we could get into all of that. So from a greenhouse gas emission standpoint, really important. But they're still cars, and they still come with many of the problems that cars create from a sustainability standpoint as well as a health standpoint. There are other things we could do that could be really positive, like speed limiters, which is putting a device in a car to make sure that it doesn't go faster than the speed limit. And there's been some adoption of this in Europe, which is a very positive thing. In my opinion, some discussion in the US. The interesting thing is that back in the 1920s, so 100 years ago, back when cars were first really taking over, there was talk about speed limiters back then. And of course, the car companies and some of these road user clubs fought against that. So we could have had speed limiters from the start, and we didn't. So we'll see where this goes. I'm not terribly hopeful. California, we almost got a requirement that cars would have speed warning systems. So there'd be some light that or buzzer that would go off if you exceeded the speed limit. But that did not make it through our state legislature. But still, this could be a way that technology would really take us another step in terms of improving safety. There are also, of course, the I'm forgetting what the device is, but for making sure people are not over the blood alcohol limit when they're driving. We could do that. We've got the technology, but we don't yet have the political will to make that happen. And then, of course, there are autonomous vehicles, which lots of excitement in the transportation field about these. Vast amount of money going into the development of automated driving technologies, both in academia and in industry. Count me among the skeptics here. I'm not sure we need them. I'm not sure why we're putting so much money into this. There is some potential for improved safety, if we can get the technology right. So that could be a positive thing. But a lot of that benefit could come without fully autonomous self-driving cars, right? We can make cars safer using some of those technologies that detect other users of the road and prevent crashes and things like that. A real concern with autonomous vehicles is that it could mean that people end up driving a lot more, because it's like reducing the cost of driving. You don't have to pay attention. You don't have to put that mental energy into it. You can spend your time doing other things. And there's a very real likelihood that if you owned your own self-driving car, you would end up driving more, just because it is easier and less taxing. And that would not be good for active travel if we have more driving out there. Again, we've got all the other kinds of issues that cars bring with them. So when we think about the future of mobility, we can think going driverless, which a lot of people are doing, but there's also another way to think about going driverless. And I'm personally a fan of the vision on the right. So then to sum up, we've got these sets of ideas, and I'm seeing some movement on all of these ideas where the traditional ideas may still be what's dominating the profession, but there's more discussion of and acceptance of the alternative ideas, I believe. And that's a good thing, because I think that gets us to a more sustainable and a more healthy transportation system. Some ideas have shifted more than others, some I would say more robustly than others, but at least there's some acknowledgement of the limitations of the traditional ideas and more consideration of the alternatives. So it does give me some hope that we might be on the verge of a paradigm shift in transportation planning in the US, where the old paradigm is all about making it easier to drive versus the new paradigm, which is about making it easier to not drive, i.e. to get around by other means. And like I said, some hope. I think I'm feeling a little less hopeful of late than I was not so many years ago. I had some hope with COVID that we learned some things there that might lead to some lasting change in how we approach transportation. And I'm not sure that's really happening. And I've actually been using this slide for well over a decade now. So we're still not, it's not clear that we've tipped all the way to a real paradigm shift. And actually, I think what we're seeing now more than a complete shift of paradigms is the emergence of a competing paradigm. So we've got both things going on at the same time. We have the very traditional way of thinking about accommodating vehicles and providing capacity. And you see that in things like this really kind of unbelievable proposal for rebuilding Interstate 35 through Austin, Texas, that the Texas Department of Transportation is pushing, versus what City of Austin is trying to do in terms of creating a multimodal system where transit is efficient and quick, and biking and walking are much more possible. So, same city, very different visions of what we should be doing with our transportation system. And I see that in California as well. I think of it as the throw everything at it mentality, where it is congestion. So we're investing in new rail systems, as in the SMART train, which runs between Marin and Sonoma counties. But at the same time, we're continuing to widen the highway that runs perfectly parallel to that new SMART train. So doing everything we can to address this perceived congestion problem. And the issue I see here is that if we're doing both things, we're not really giving the new paradigm a fair chance, right? It's the continued investment in our highway system is undermining efforts to really change our approach to transportation. We're not committing as strongly to the alternatives as we really need to be. So we'll see where it goes from here. Like I said, there's a lot to be hopeful about, but it's the profession's had a really hard time letting go of its traditional focus on cars and prioritizing the needs of cars. So I wish I were in charge. I'm not. If it were up to me, we'd stop worrying so much about cars and congestion. this obsession with congestion is my latest obsession. I think that's a big part of our problem, is just the way we think about congestion and how much we direct our efforts around trying to find solutions to congestion. And really what we need to do is to start worrying more about people and places. And I think if we did that, we wouldn't have to focus on congestion. The problem would take care of itself. And we would end up with a much more sustainable and a much healthier transportation system. So thank you for listening. I hope I've given you some food for thought, and I'm looking forward to questions and discussion. And of course, I've got to do a little pitch for my book. If you're interested in all of this, I'm told it's a nice introduction to the transportation field and how things work. So thank you.
Thank you very much. You can call on people who have their hands raised if you'd like.
Great. Well, I see Megan first.
Thank you so much, Susan. Such a great presentation. I want to steal all your slides. One question I'm starting to think more about is, I feel like a lot of this has to do with behavior change and tipping people into demanding more transit and bikes and walkable cities. And I'm starting to think about, like, do we have to pay people to bike? Or like, I'm even thinking about myself personally, like, what would it take for me to use my bike to get to and from work? And money's a motivator. Has anybody looked at that or tried that? Or
Yeah, there's a little of that going on. I think transportation has a lot to learn from public health in terms of how do we change behavior? How do we create the right incentives for behavior change? Because, we've always focused on infrastructure, but it really is all about behavior. So, well, there are e-bike incentive programs. So state of California, for example, is about to finally launch e-bike incentives. I forget how much it is, $500 or $1,000 towards the purchase of an e-bike. Interestingly enough, when our University of California graduate students went on strike 2 years ago and negotiated a new contract, one thing that's in that new contract is an e-bike subsidy. I still don't know how that got in there or who put it in there, but so that's sort of one way of paying people. I have heard about companies, there may be a few of them out there that have paid people to bike or walk to work for, because it could be motivated by health. They're trying to get people to be more physically active, or, there's some areas that have these air quality regulations that require companies to reduce driving, driving alone, commuting. So in those cases, the companies have an incentive to get people out of their cars. Yeah, so I think there are some versions of that, but maybe not as systematic as it needs to be, and probably needs to be studied a lot more than it has been when those things do happen. I do want to, you said something about, people need to start asking for these things. That's another really important point. And of course, that is going on in a lot of communities. They're very strong bicycle and pedestrian advocacy groups. But I always go back to that congestion obsession, that you might get people asking for biking facilities, but those voices saying, we've got a congestion problem and you've got to solve the congestion problem, that's really powerful from a political standpoint. And the fact that the public doesn't understand that widening the freeway is not going to solve the congestion problem, that's a really big problem right now in making this kind of change happen, in my opinion. Benna.
Yeah, hi. Amazing presentation. I'm Dutch and I used to bike, and in Baltimore I stopped biking because it's highly dangerous. several events. I even stopped walking for a while because I got hit just by
Oh,
cars.
oh,
So
sorry.
my point is, yes, there are incentives, but it has all to be with safety and design. And I think you're mentioning a lot about transportation. I think city planning, because we're still making all these enormous suburbs, which all only can be accessed by cars. So city planners need to be super integrated with transportation planners so that we design urban areas, suburban areas, city areas that are integrated and safe to use these other modes of transportation, so that there's no need to get a car, and so that it is safe to take a car, to bike or to walk to work or wherever. So I think Europe has this advantage that they're old city, so they are already congested, so they have to work with that confined space, and they don't have that suburban sprawl what we have the opportunity to do so here in America still. But I think that redesigning what New York is doing is great, and so rethinking how existing cities, but also that any new suburb should be completely redesigned, because that's their opportunity. So I just wanted to throw that out there.
Yeah,
And
totally agree with you. Yes, absolutely. Our land use planning and our transportation planning have to go together. And that's been
Yeah.
one of the challenges in the US, is that everything is so siloed in terms
Yeah.
of who is responsible for what. So, you know, the city level is where it's easiest to make things happen, because the city is responsible for its local streets as well as its land use planning. The highway system, you know, then you've got higher levels of government really getting involved in there. So that's where some of the disconnects happen. And then, yeah, we've got all this, the traditional way of thinking on the land use side of things has also been very problematic, leading to our low density suburban sprawl, where residential uses are separated from commercial uses, and you don't live close enough to anything to be able to walk there, let alone
Yeah.
that it's not safe to get there. Yeah, so we need a lot of change on the land use side of things as well.
Yeah.
And I think there has been some of that. You know, I'm seeing proposals for new developments that are much more thoughtful about making sure people have alternative ways to get around. Not always, but some of them. But then we've got all this existing suburban development. What do we do about that? How do we rebuild that to be less car focused and to, you know, just make for better communities? And that's really challenging and long, slow process. Yeah, I mean, I think, again, I'm a huge fan of e-bikes. I think they have a really important role to play in those kind of suburban environments where things are a little more spread out. But we've got to put in the kind of bike infrastructure that makes biking safe in those places. If we can do that, then with the power of e-bikes, I think, you know, and some amount of transit service, we start to create some opportunities to be less car dependent.
Yeah.
Yeah.
I have another question, but I'll save that one after.
Okay. Salvatore.
Yeah, so my question is, aside from, you know, the obvious like behavior change and like economic issues related to kind of like using public transport, I think this is largely a cultural issue, no? Because like even now, walking on a sidewalk in Baltimore, there's issues with like people not wanting to move over, share the sidewalk. Like if people have multiple dogs, sometimes there are like issues there. So I'm just kind of curious if there's any like understanding of like, is this more of a cultural issue, and what can be done to push that like culture of being kind, I guess, is kind of ultimately what it is. It's like, can you just be nice and considerate of people?
Yes, I agree with you that there's a cultural element here. I mean, from the just we are a car culture, right? And that's, the assumption for most people is that driving is how you get around, and they never even think about walking, biking, transit as a possibility for them. So, so yeah, that's a problem. I think it's also an excuse that people use to say, well, we don't need to invest in these other modes because, culturally, nobody's ever going to accept it here. But then, Americans go on vacation to places like the Netherlands and they experience it and they love it. So it's a hard thing to untangle. There are some researchers out there that try and understand this, how we untangle it, another question. But then, you were also talking about just how we behave in the transportation system. And that's also a really huge issue. I think there may be differences in different parts in the US in terms of, how pedestrians treat each other, or, bicyclists versus pedestrians, that sort of thing. Yeah, more to be understood there, how we change it, make it better. I don't know, maybe some of you have ideas about that. I was really disturbed to read about an incident in Paris just in the last couple of weeks where, Paris is being really aggressive about trying to restrict car use in the core and make it much more of a bicycle pedestrian friendly environment. And a bicyclist got run over, apparently intentionally, by an SUV. And the way it was reported on, it was almost justifying the that the driver, like, oh, drivers are so upset about the fact that they're being restricted that they're, of course, rightly angry about that, which is just appalling.
Yeah.
But anyway, it's not just the US, this sense of car dominance, unfortunately, is taking hold in other parts of the world as well. I do want to tell a really quick little story about I had a PhD student who just finished at the end of the summer, and he's doing a postdoc at Morgan State. And he was, unhappy that he couldn't bike. He didn't feel safe biking from where he's living to get to campus. He's from Bangladesh. And when he came to Davis, he didn't know how to bike, but I think it was a Dutch student, actually taught him how to bike. And he said his bike was his freedom. He just loved it, and he didn't have a car here, so having a bike was his freedom. And I just love that. And then I'm just sad that unfortunately in Baltimore he's not feeling safe to bike there. Dana, you had another question?
Yeah, I had a question about, you mentioned you hinted on that governments and urged by opinion groups, etc., consumer groups, would be able to push for some of this change. Because I was wondering, I mean, the same as that what you mentioned, there were no cars. And then under Eisenhower, there was a beautiful transportation system with trains, for example, that connected the whole US. And that also, I mean, you haven't talked a lot about flying. Some people fly for their work because they need to go.
They do.
So the train system reduces flying, for example, the longer distance. And a lot of that got rid of under the Eisenhower administration. But that was at the federal government level. So if federal government starts implementing and demanding change, same as at the New York level or at the London level, and now the Paris level, at the government level, they restrict, people will follow, because it's eventually a rule, and some people will demonstrate, but if that was informed by the general sense of the public and they're behind it, people will follow, and it will change. So because it changed under Eisenhower, it can change back in a sense, right? What is your opinion about that?
Yeah, well, I love your optimism. So it's kind of a, complicated thing, but transit and rail before the 1960s was almost entirely private sector in the US. There was very little government involvement. So the old streetcar systems, with a few exceptions, were all private companies. And so, I tell my students, really the story of transportation policy is that, federal involvement from around World War I, federal government first started getting involved in road building because they saw a justification for their involvement. And then, they've been doing it ever since. But federal involvement in transit didn't come about until the 1960s.
No, but they don't even have to pay for it. But they facilitate or they restrict cars over something, and then the market will follow, right? No?
Well, yeah, easier said than done. So the federal government is not making, well, supposedly not making direct decisions about what to invest in. The federal policy is about funding. They give the funding out to states and transit agencies who are making the decisions about how to invest.
No, but I'm not even saying that the government or local or federal should pay for the transportation. They should put the rules, the regulations there, and then the market will follow. I mean, we don't say that car companies need to make cars, right? But by California saying by 2035 they need to be electric, going to make them electric.
Yeah, well, I challenge you to try and get the federal government to say it's all got to be rail and not cars.
No, not all, but I mean they have influence, right? They can direct where the market goes.
Yeah. So the Biden administration, we passed a new transportation bill under the Biden administration, and a lot of talk about more money than ever going into transit, and we're gonna support this and that. There was a lot of innovative stuff in there, but still 80% of the money is going towards highways, either maintenance or expansion. And there's just so much political power behind continued investment in the highway system that even in California, where we have official policy about trying to get people to drive less, we are still expanding the highway system. So I love your vision. Just there's a lot of political inertia to making significant change. Shima.
Yeah, thank you so much, Susan. What a fantastic presentation. I learned a lot from your presentation. A question, you mentioned several times during your talk then that the kind of research is ahead of action or practice. We have tons of evidence for many of these ideas that you presented, but they just don't get into action. I was wondering if you could share a little bit about what do you think then, what could be the role of us in academia if we want to be part of this paradigm shift, if we want to be able to contribute. If that's not about evidence, then what could be our role?
Well, the evidence is absolutely important. And I think the problem is the evidence is not enough, right? So how do we make sure that the decision makers are acting on the evidence and taking the evidence into account in their decision making? And again, I think there are probably some lessons from public health that transportation could learn about how you do that. I mean, as a researcher, I'm constantly struggling with this. Like, what else do I need to be doing to help change hearts and minds and knowledge and understanding about these issues? So, we always try and make sure that we publish our peer-reviewed journal articles, which puts our work into the evidence base and gives it credibility and all of that. But then we've got our little one-page brief that highlights the key points out of that research that you could hand to a decision maker, and maybe they'd read it, or at least their staff would read that. We do briefings for the state legislature. Once a year, we go to Capitol Hill and do a briefing for, it's the Congress people don't come, but their staff come, and we're trying to educate them and, share with them the important findings, our important findings. I do media interviews whenever I get asked. There's been a lot of coverage of this induced travel issue, New York Times, LA Times, lots of others. So I'm trying to.
So you think it's more about dissemination to be able to really?
Yeah. Well,
Okay.
yeah, and figuring out how to talk about it in plain English, in a way the public can understand. I've done several kind of community events where I've kind of gone through this and tried to help people understand the phenomenon and the implications and all of that. Yeah, but it's a lot of work, and I'd love to hear from any of you about ideas about how do we get it out there. But I think we've got to be, we need that solid evidence base. That's the important role we play. And then the question is, how do we get somebody to do something with it? Some of what we've been doing is what I call translational work. So we're taking the evidence and converting it into a document or a tool that agencies can use in their decision making. So we've got our induced travel calculator that's actually being used in California as a part of the environmental review process. One of my colleagues developed a cost benefit tool for bicycle and pedestrian projects that, based on all of the research that's out there. So a city, if they're proposing a project, can kind of go in and look at, some things can be quantified, but at least they can kind of cite other things to say this is going to have these kinds of benefits. So I think that translational work is really important too.
Thank you. Thank you, Susan.
Well, thank you very much for a wonderful talk. I guess everybody can kind of do their clapping things if they have the emojis, or if not on camera. I'm just going to ask for students that want to still to hang around, and everybody else can say goodbye to Dr. Handy, and thank you so much for a great presentation. I'll stop recording now.
Yeah, my pleasure. Feel free to email me if you want to follow up. And I do have a little time if anybody's got more questions.